Good morning, all. So, we'll be continuing with the diagnostic procedures. We have already gone through the blood investigations, isn't it? And we had started also cardiac enzymes. Now, moving on to the next diagnostic procedure. What is the picture of this one? This is actually a chest x-ray, isn't it? So, we are already aware chest x-ray is a method of actually detecting abnormalities, isn't it, from the chest. And mostly different tissues in the body absorb the x-ray at different extents, isn't it? So different tissues in the body, they absorb the x-ray at different extent. For example, in the x-ray we can find out bones, even tissues, and even the air presence, isn't it? So bone is having high absorption, so that is why it appears white. Okay, and tissues, they are almost having a middle absorption, so that is why they appear gray. So here you can see almost gray parts are also there on the chest x-ray. Then air, since air is having very low amount of absorption, it appears as almost blackish. Okay, so that is why we see different like this black or gray or white patterns are seen in the chest x-ray. Okay, so now next, what are the purposes of a chest x-ray? Now we are already aware why we do the chest x-ray. Commonly we are doing the chest x-ray to most of the times know about the respiratory conditions, isn't it? Any respiratory disorders are there, especially which is involving the lungs. Okay, and here we are studying cardiac problems, isn't it? So we know that even chest x-ray can be taken for detecting any abnormalities of the heart, like we can find out the position of the heart, then the contour, the shape, if there is excess of fluid accumulation or excess of air is present, all this can be checked in the chest x-ray. And along with that, disorders of the bones of the chest wall, that also can be detected. Or if there is presence of fluid in the pleural space, like to know about pleural effusion, or to know about hydrothorax or hemothorax. Okay, all that we are performing a chest x-ray. Other than that, to know about if at all there is excess of fluid accumulation in your peritoneal cavity or even in the pericardial sac, okay, that this chest x-ray is helpful. And chest x-ray is also it finds out regarding the changes in the pulmonary arteries as well as in the pulmonary veins. Okay, and patient is placed in two main positions. If you are seeing the chest x-ray, when the doctor writes down for the chest x-ray, usually they will write down as PA view or AP view, isn't it? What do you mean by PA view? PA view means actually posterior anterior view. Okay, and in PA view the x-ray penetrates through the back of the patient. Okay, so x-rays penetrating from the back of the patient, we call it as a PA view. And AP view means anterior posterior view. Okay, AP view. And AP view means here the x-ray is penetrating through the front of the patient on the film. Okay, and one more is there, some lateral views are also there, that also can be done. So you have to know that here we are mainly finding out regarding the size of the heart or any other fluid accumulations, or the shape of the heart, margins of the heart, all this can be detected in the x-ray. Okay, and now x-ray, sometimes it can do a plain x-ray also, you can go for a contrast x-ray. Okay, where you are giving a contrast media to the patient, it is injected. Okay, so contrast media may be injected to the patient and then you may be taking a series of x-rays. Okay, and commonly the contrast media which we give to the patient are Conray or barium sulfate. Okay, these contrast media will be given. Some of the contrast media can be given orally to drink, some are injected. Okay, so different methods are there. Sometimes you just take a plain x-ray, you don't require these what we call contrast medias. Okay, so always you have to remember that before giving any contrast media, you should always find out if the person is having any allergy to this contrast media. Okay, so you can give a test dose to the patient and check beforehand. Okay, then, now how will you prepare the patient for a chest X-ray? Commonly, we know we don't require much time to prepare the patient. You just inform to the patient that you have been taken to the X-ray. Okay, so before doing all that, if the person is a female, what we do is we ask them if the person is pregnant. Okay, because normally uh, during pregnancy it is contraindicated. Okay, and other than that, what you do is ask the person to remove the clothes and put on the hospital gown. Okay, so usually the person will be in hospital gowns, and if they are having any jewelries, any clips or safety pins are there, or they are wearing eyeglasses or any other metal objects are there, you should ask the person to remove it. Okay, because they will interfere with the x-ray image. Okay, so we don't want it to get interfered in the x-ray image, so ask the person to remove all these metallic jewelries. Okay, then next is you should explain to the person how they have to stand. Now most of the time, small children, it is very difficult to take x-rays because they will move this side, that side, or they will usually be restless, they don't stay in one place. Okay, but here when a person is taking an x-ray, you have to inform the person that they have to stay still, they should not move. Okay, and most of the time what happens is the person will stand against the x-ray machine, and then they will be taking the x-rays. Okay, so always you have to remember that in x-ray you are using certain ionizing radiation. Okay, so it involves ionizing radiation, so that is why we don't give it to the pregnant ladies. Okay, and the entire x-ray procedure, you know how much time it takes, hardly it will take around 5-10 minutes or hardly 15 minutes. Okay, and nowadays we have also got portable x-ray machines. Now portable x-ray machine means it is easily carried or easily moved. For example, in the ICU, if you are advising an x-ray, what you do, you have to take a portable x-ray machine to the ICU, and then you will take the x-ray of that patient. You cannot move the ICU patients each and every time from the ICUs, isn't it? Okay, so that is an portable x-ray machine. So not only x-ray machines, we have got lot many other type of machines which are portable, which we can move. Then some general instructions are there, or some other pre-procedures which I have already told. So check for the history of any allergies, because sometimes we may be giving contrast media to the patient. So what happens? We can perform the test dose. Okay, you can perform the test dose. Ask the person if they are having any allergies to any iodine compounds or any other contrast media. And sometimes when you just give the contrast media to the person, they may have some sensation, that also you need to explain to the patient. For example, when you inject the contrast media to the patient, they may have sudden flushing of the face, or increased salivation, slight feeling of nausea or vomiting, feeling of warmth, the tingling sensation, or watering from the eye. These all things can be felt. Okay, so that you have to explain before the procedure. And also tell that the person may need to take a deep breath, and they have to hold it for a second or so when they are taking the x-ray image. Okay, so that will be usually advised by the x-ray technician. Okay, and if a person is having very long hair, means you have to ask the person to tie the hair up. Okay, and here you can see the some of the x-ray films. Okay, here you can see the person is having cardiomegaly. Cardio refers to heart, and megaly means enlargement. So here the person is having enlargement of the heart. And this is a abnormal x-ray again. Okay, it shows that person here is having heart failure. Person is having a not only enlarged heart here, but also there is a fluid filled in the lungs. Okay, so this is a picture of the heart failure where the heart is not able to pump adequate amount of blood. Okay, so that was about chest x-ray. Now moving on to the next topic. Okay, the next topic here we are going to deal is regarding Holter monitor. Okay, Holter monitor. Now Holter monitor is a very important topic. It can be asked for 2 marks. There is one more name for Holter monitor, that is ambulatory ECG monitoring. Don't get confused. ECG is a different procedure. This is ambulatory ECG monitoring. Ambulatory means walking, moving around. And ECG, electrocardiogram. Okay. So when you're moving around also, or when you're doing your activity also, you can perform your ECG. That is a Holter monitor. But you might have only heard about a ECG which is done when the person is sleeping, and then you are putting the electrodes for the person, isn't it? Chest electrodes and limb electrodes. That is a normal ECG which we do in the hospital. Okay. This is a little bit different procedure, that is ambulatory ECG. It is also called as a Holter monitor. Okay. Now Holter monitor, as you can see here in the figure, it is a battery powered device. Okay, here you can see it is a battery powered device. Here some batteries will be there inside this recorder. Okay, and you can also record the entire ECG, and it is connected to some electrodes will be fixed to the chest. Wherever required, you will fix the electrodes. There can be around 5 to 7 wires also. Sometimes these wires are called as leads. Okay, and electrodes are placed on the patient's chest. Okay, remember that. And there is a battery in the recorder where you can record the entire ECG. Okay, usually in Holter monitoring you will record the person's ECG for 24 hours or up till 48 hours or little longer. Understood? So remember the difference here. Okay, so here you are actually recording the ECG of the patient for 24 hours or more, up till 48 hours or sometimes more also. So in a standard ECG, okay, that is which we are using in the hospital, it is the simplest and fastest test which is done to evaluate the heart. But here what you are doing, after 48 hours you will take the recordings from this battery, and then you will check whether there are any changes in the ECG. Okay, now what you may think that whether the person is able to perform the daily activities when the person is connected with these electrodes and all. Okay, so we'll see regarding this Holter monitor in detail. So again, I'm just telling you about the definition or meaning of Holter monitor. Holter monitor is a battery powered with the recorder, and it is also having some electrodes which is placed on the chest. So it will help to detect the ECG. Okay, that is it records the electrical activity of the heart. It will help to know the heart rate and heart rhythm. Okay, so that is a Holter monitor. We can use it for 24 hours or 48 hours or sometimes even longer. Okay, so definition is it is a type of ambulatory ECG. Remember, the word ambulatory means you are able to move here with the ECG. It is a portable device. Portable means already I told you can carry it anywhere. When you're moving around also, it is going with you, and you wear it for around 24 to 48 hours. Here also it is very clear. Okay, so this is the Holter monitor machine. Now, what is the difference between the normal ECG that you're doing and what is the difference between a Holter monitor? We'll see that. Okay. Now, a Holter monitor, as I told, it will record the ECG continuously for a period of 24 to 48 hours or little bit longer. And it will store the entire heart rate and heart rhythm. So whatever you have done for 24 to 48 hours, that everything you are able to record. Okay, and if you want, you can take the printout of it and also see whether there are any changes. But ECG, the standard ECG, what you are doing, whether you can keep it continuously for 24 to 48 hours, no. It is only done immediately, and then you will take the reading and you will see, isn't it? You will evaluate immediately. It is quite accurate here. Okay, the normal standard ECG is also quite accurate, but it is done in emergencies. Okay, now, particularly in Holter monitor, what happens is you are having the freedom to perform the normal activities of daily living. Okay, so Holter monitor is fixed to your body. At that time, you can perform the normal activities. You can do anything except swimming and taking bath. Okay, because you're connecting to a machine. If you jump into the water, the machine is going to spoil. Okay, and it will not record. So other than swimming and other than taking bath, what you have to do, you can perform any activities. All right, so in the case of Holter monitor, it is advised that the patient has to maintain a record of all the activities. For example, yesterday evening they have put the Holter monitor. Okay, and after reaching back in the morning, you after reaching back at home, you had dinner, That you will write down. Then you slept. What time you slept, you will write in your diary. Next, you will write down early morning, what time you got up, you brushed your teeth, you performed brushing, or after that combed your hair, or you went to empty your bowel. That also you can mention. You had your breakfast. Okay, you went for walking around. Everything you have to maintain in the diary. Okay, if you slept, that also you have to maintain with the timings. Okay, so remember, when you are in the Holter monitor, you can do any activities, but you should maintain a small diary and you have to write down the timings and what activity you have performed. Now, whether you can do it in your normal ECG when you're connected to the normal standard ECG, no. You will be put, person will be made to sleep. You will connect the electrodes and tell the patient not to move, isn't it, when you're taking the ECG? And then you will take the readings, that is in a strip you will take, and then you will remove all the electrodes that are connected, and you will tell the patient to go. That is a normal standard ECG. But here what you are doing, the person can do their activities normally. Okay, and then you should always remember that whether it is chest x-ray or whether it is a Holter monitor also, both are non-invasive procedures. What do you mean by non-invasive? Now, non-invasive means they are painless, they don't cause any sort of pain. Okay, so that one more point you should remember for Holter monitor. It is a painless and non-invasive procedure. And next is, you should always remember that once a person is in the Holter monitor, they cannot get it wet, they cannot go into the shower, they cannot go for swimming, or they cannot take bath. Okay, next is, how will you prepare the patient for Holter monitor? Suppose you have decided to go to the doctor tomorrow to get it fixed, Holter monitor to get it fixed. What preparations will be done? So initially there is no much of preparation here, you know, because it is a non-invasive procedure. There is no need of sedation, nothing. Okay, so only main thing is you will take a thorough bath and go before, because after fixing the monitor you cannot have bath. Okay, so have a thorough bath, clean your entire body and all. And suppose there is a lot of hair all over the chest, in that case the nurse may just perform some trimming, or may just remove the excess hair that is present. Okay, they may just trim off the excess hair, because it will be very difficult to put the electrodes and all. Okay, so after that what they will do is, they will connect the electrodes. We have already seen in the figure, isn't it? Some electrodes, they will be connected to the chest. Okay, and after it will be connected to the chest, what they will do, it will be connected to the lead wires and then to the box which is having the recorder and the batteries. Okay, so that I have already shown you in the figure. Okay, so here also you can see this is the electrodes that are fixed to the chest, and then we have got the lead wires. Then next we have got a recording device with the battery inside that. Okay, and then some other points. You should remember that Holter monitor is continuously monitoring your electrical heart rate or heart rhythm for 24 to 48 hours, and you have to maintain the diary of events, whatever is happening to you. And along with that, suppose when you are sitting, or whether you're eating or after eating you experience any symptoms, it could be like you can experience palpitations, or slight chest pain is there, or fainting episodes are there. Everything again you should maintain in your diary clearly. Okay, so maintaining that is also very, very essential. Now, what is a nurse's role when a person comes for Holter monitor? So what I have explained in the procedure, same things you can explain here. So nurse's responsibility will be, first is to explain the procedure to the patient, what will be the cost of it, and then you should tell that if excess of hair is there, they will shave the area. And the nurse has to tell that electrodes will be placed on the chest, and the lead wires are fixed to a recorder with the battery that is around the waist of the patient. And tell them that it is actually, they can perform their normal activities and they should maintain the record of all the activities and also the symptoms that they experience. Okay, and nurse should also tell that they should not take bath when the person is in the Holter monitor machine. Okay, then this points I have already told. Now certain small risks are there when the person is with Holter monitor. The only risk here is the person may experience some skin irritation, because the chest electrodes are kept for a longer duration of time, it becomes sticky, and the person may experience some skin irritation. Okay, and one more thing is that you will be telling the person not to take bath and not to go for shower or for swimming, isn't it? So for 24 to 48 hours they cannot get the machine wet. Okay, and other than that, because it is a machine here, tell the person to avoid electrical blanket, avoiding electrical razors, magnets, high large magnetic devices, metal detectors, all this has to be avoided. Okay, and then tell the patient to note down all the activities. Okay, so that is regarding the Holter monitor which we studied. Holter monitor is a small wearable device that will keep a track of the heart rate or the heart rhythm for 24 to 48 hours. It is ambulatory device. Okay, so that was regarding the Holter monitor.